This is the fourth video in the series Quality Improvement Workshop about teamwork. For more videos, visit my Facebook page, Healthcare Quality. The most significant gains in quality are usually achieved by teams. Groups of individuals pooling their talents as well as the expertise they have developed by working at different stages of a shared process. You are one link in the process of delivering quality healthcare. On a team, each one brings different experience, skills, know-how, and perspective to the issues you deal with every day. Such a diversity is important to members of quality improvement teams. A single person trying to remove a problem or deficiency, no matter how skilled, has rarely mastered the details of an entire work process. Coming together is the beginning. Keeping together is progress. Working together is success. Together is the key word. The second main issue is how to document those valuable activities in a well-arranged way to keep what we have reached for ourselves to continue building on it, and for others to make use of this information whenever we face a similar problem. Project team meetings are working sessions to identify, analyze, and set in motion actions needed to improve quality. These meetings also provide an opportunity for team members to share information, ideas, and experiences. The participation of each member is key to the team's success. The diverse personalities, attitudes, and needs of individual members can create barriers that interfere with team interactions. Examples of these barriers may be overly talkative team members, no response situations, quiet team members, irrelevant issues, side conversations, disagreement among team members, fear of rejection, and senior team members. Team meetings run smoothly when its members are able to concentrate on their primary goal, which is to make a specific quality improvement. Effective discussions use several skills that all team members should develop or enhance. Building rapport, giving feedback, and negotiating differences. Liberal use of such words or phrases as let's, we will, we can, together, and perhaps helps to establish your willingness to be cooperative. At the same time, you will need to avoid using unnecessary imperatives, negatives, and ultimatum communicated by phrases such as you must, you cannot, you should, don't, never, or no. Stages of team growth. Most teams go through 4 predictable stages as they work together. Stage 1, form. Stage 2, storm. Stage 3, norm. And stage 4, perform. Over time, as team members work together, they usually become more knowledgeable about and more comfortable with the human dimensions inherent in teamwork. Understanding each stage and recognizing that most teams successfully arrive at stage 4, perform, will help you keep a sense of perspective and move your project forwards as your team experiences difficulties during the early phases of its development. Different rules within quality improvement teams. Team leader is an active member of the team, providing direction and support. Involves in both meeting process and content. Not responsible for all decision making. Not responsible for team's success or failure. Rules and responsibilities. Prepare for meetings. Conduct meetings. Assign activities to team members. Provide direction. Assess progress. Interface with other teams and support resources. Represent the team to management. Follow up with team members as necessary. Document minutes and other records and communicate with facilitator and others. Each team member. Attend and participate in all team meetings. Help build meeting agenda. Help critique and improve the meeting process. Share experience and knowledge. Each member participates in team activities by identifying opportunities for improvement, identifying issues, process flow, and root causes, collecting and analyzing data, recommend corrective actions to management, and track effectiveness of solutions. Team facilitator. He is not a member of the team, which means that he doesn't share in voting. He serves as consultant or coach and keeps the team focused on the meeting process and purpose. Rules and responsibilities of team facilitator. Help the team leader. Seek opinions of all team members. Coordinate ideas and test for consensus. Assist team in applying quality improvement tools and techniques. Summarize key points. Provide feedback to the team. Team recorder. In fact, it is a rotating position among team members. He has to keep minutes and other records to meet documentation requirements and facilitate team recall. Now we come to the content and format for documenting team minutes. Team minutes should contain the following information: meeting date, time meeting called to order and adjourned, attendance, members present, members absent, members excused, and guests. Minutes also contain old business, which is a follow-up concerning actions or outstanding issues from previous meetings. It includes summary of discussion and conclusion and actions if appropriate. It also includes new business, new issues related to performance improvement activities or operations. Also include summary of discussion, conclusion, and action if appropriate. And in addition to authorized signature approving the contents. The format for documentation: use findings plus the acronym CRAFE. This meets documentation standards for committee or team analysis of data, as well as case-specific performance improvement activity. For the findings, it includes what was reviewed or analyzed, time period of review or analysis, number of cases reviewed or summary of data collected, documented performance including percent of cases meeting criteria compared to the established trigger for intensive assessment. The first letter of CRAFE is C, which equals conclusions. Were the standard of care or the process specifications met? If yes, is there an opportunity for improvement found anyway? If yes, is the function, process, indicator, or criterion appropriate? If no, is the problem caused by system defects, insufficient knowledge or skills, or deficient behavior or performance? If no, what is the severity of the problem? If maybe, was the sample size insufficient? The second letter is R, which equals recommendations. Examples of such recommendations are: trend for such occurrences over time, continue to measure and analyze, perform focus study or intensive analysis, if opportunity for process improvement, refer to quality improvement team, if insufficient knowledge or skills, provide education or training, if deficient behavior or performance with unwillingness to change, determined by peer review and initiate discipline. The third letter is A for actions. There is always action even if the decision is no action indicated based on the conclusion. Provide specifics if appropriate based on the expertise of the members, or refer for specific action input and schedule follow-up as old business for the next meeting. Revise selection of functions, process indicators, and/or criteria if warranted. Assign responsibility for action, follow-up, etc. Considering severity, assign time frame for development and the implementation of the action. Add data to practitioner profile if indicated. F for follow-up. When to present next information. Report back concerning trend data. Report back concerning specific action ideas. When type of information is expected back. E for evaluation, which is usually done periodically, and it means the status of action effectiveness, the status of trending or continued efforts to measure and assess, improvement realized, sustained over time, and etc. Thank you.